Good morning, my dear students. As you know very well, I am Dr. Jayaprakash, Professor of Forensic Medicine. Now, let me talk on somewhat expected question or important questions which may be asked in FMG, upcoming FMG or even NEET 2022 examination. Okay, I am going very fast. Okay. Now, what do you mean by juvenile? All of you know very well who is juvenile. Juvenile may be a male, maybe a female, aged less than 18 years. Aged less than 18 years. And in case a juvenile commits any crime, the trial not takes place in our regular courts, it will be taken place in a juvenile justice board. Juvenile justice board consists of 3 members. Number 1, judicial magistrate of first class, preferably female. Remember, not always female, preferably female. And 1 female social worker and another male social worker. These 3 together constitute juvenile justice board. And here, out of these 3, JMFC may be a male, may be a female, but preferably female. But the presence of female social worker is must. That means, instead of male social worker, there can be another female social worker, but female social worker cannot be replaced by male social worker. Look here, this is a very important question. Juvenile Justice Board shall always consist of, as you know the answer, female social worker. Okay. Now, if a juvenile commits a crime, what happens? If juvenile commits a crime, maximum 3 years of imprisonment can be given. Maximum 3 years of imprisonment for a juvenile. But after Delhi gang rape, there was an amendment for the section, and according to this, if at all the juvenile age is between 16 and 18 years, and if he has been involved in a heinous crime, remember, that is very important. What do you mean by heinous crime? Heinous crime is any crime for which imprisonment is more than 7 years. Remember this. Heinous crime is any crime for which imprisonment is 7 years or more. For example, rape, murder, waging war against the country, terrorism, all these are heinous crime. In such cases, even though he is a juvenile or she is a juvenile, she will be tried just like an adult in any other regular courts, not in juvenile justice board. More than 3 years imprisonment can be given. More than 3 years imprisonment can be given, but no life imprisonment, no death sentence. Okay, no life imprisonment, no death sentence. For example, if a person aged 17 years has been involved in a gang rape, even 20 years imprisonment can be given. Because for gang rape, 20 years to life imprisonment. But no life imprisonment, no death sentence. So, look at this question. Now already I think you got the answer. Maximum punishment that can be given under Juvenile Justice Act 2000 after amendment is. Before amendment, it was maximum only 3 years. But now it depends on the crime. It depends on the crime. Okay. So, answer is depends on the crime. Inquest held in India. Remember, this is a very, very important question. Inquest means inquiry to ascertain certain matters of fact. In forensic medicine, usually to inquire into the cause of death. Police inquest is most common type of inquest in India as per section 174 of CRPC, that you should remember. This particular section you should remember. Magistrate inquest as per 176 of CRPC, that also you have to remember. Okay, here in case of police inquest, as I said, it is the most common inquest. There is an important question, what is the minimum rank of a police to hold inquest? It is Head Constable of Police. Head Constable of Police. See, I can see the comments here. I can see the comments here that answer given for the previous question is 3 years. It is not 3 years. Before amendment, 3 years. But if it is a heinous crime, it can be more than 3 years. Okay. So your answer should be depending on the crime. Okay. Depending on the crime. Okay. At the same time here, what student has asked, sir, please go slow. To go slow, it is not a regular class. This is a revision class. Rapid revision class. And at the same time, you are getting the recorded videos also till your examination as per our directors. Okay, they already clearly told. This recorded video will be getting. You can go it again. Okay. Now, magistrate inquest, there are two types of magistrate. Number one, judicial magistrate, and number two, executive magistrate or non-judicial magistrate. Executive magistrate or non-judicial magistrate. Who are the judicial magistrates? The judicial magistrates are Chief Judicial Magistrate or CJM, Judicial Magistrate of first class, and Judicial Magistrate of second class. Judicial Magistrate of first class, Judicial Magistrate of second class. Okay. Whereas executive or non-judicials are usually revenue officers like District Magistrate, Additional District Magistrate, Subdivisional Magistrate, District Collector or Commissioner, Assistant Commissioner or Assistant Collector, Tahsildar, or even Deputy Tahsildar, Deputy Tahsildar. All these are executive magistrate or non-judicial magistrate. Remember, most of the time, whenever magistrate inquest is required, executive magistrate will hold inquest. Remember that in your mind. But in some cases, judicial magistrate inquest is compulsory. It has to be done only by a judicial magistrate. When? Number one, death in police custody. Number two, rape of a woman in the police custody or disappearance of a person in the police custody. That I will tell you later. But when executive magistrate will hold inquest, if at all a married woman who dies of unnatural conditions like suicide or suspicious death within 7 years after marriage, magistrate inquest has to be done and usually executive magistrate will hold inquest. Number two, in case of exhumation. Exhumation means digging out of a body from the burial. Maybe for the purpose of second autopsy, maybe for the purpose of identification or whatever it is. Number three, death caused by the police or suspected to be caused by police. So for example, death by police firing. Magistrate has to do inquest. Or a person is being taken by a police from one police station to the other police station, the court of law to prison. Whenever there is suspicious that the police must have killed the person, then magistrate inquest should be done. Okay. Whereas, as I said, judicial magistrate inquest is compulsory in case of number one, death, number two, disappearance, number three, rape in police custody. Remember, I will show you the questions. Okay. Okay. Now, what do you mean by police custody? Police custody does not mean only in the police station, in the police custody. Any other custody, for example, a person dies in a hostel school or remand home or in the jail, okay, or a prisoner has been transferred to the mentally ill hospital, and if he dies in a mentally ill hospital, mental psychiatric hospital, again, judicial magistrate should hold inquest. Police custody does not mean only in the police station. Wherever custody of a person is authorized by the magistrate or a court of law. Remember that very well. Okay. Now, here, somebody asked, dowry death. See, any time a woman dies within 7 years of marriage, it is not dowry death. Magistrate will hold inquest, then he decides whether it is related to dowry or not. Okay. Now, Inquest by judicial magistrate is compulsory in case of death in police custody, yes. Disappearance in police custody, yes. Rape in police custody, yes. The answer is all the above. All the above. Inquest by judicial magistrate compulsory in case of, as already said, prison, police custody, Boston school. The answer is all the above. Okay. In case of death in police custody, inquest is held by. Now already you have become perfect. Police custody, it should be judicial magistrate. It should be judicial magistrate. Okay. In India, magistrate inquest done in the following cases, except dowry death. I said magistrate, executive magistrate. Exhumation, maybe executive magistrate. Death in police custody, judicial magistrate. Murder, police can't do. Police can't do. Now, what will you do in case you receive two summons from two different courts to attend on the same day? Okay. Now, most of the time, students always say that you have to attend the criminal court. It is true, but before that, there is another clause. What is that? Look here. Always he should give first preference to the higher court. Say, for example, you get one summons from the district session court or another summons from the chief judicial magistrate court, then you have to attend the district court. At the same time, if you get district civil court one summons, meantime, CJM for a criminal case, you have to attend the criminal court first. Okay, I'm sorry. I think you got confused. See, always you have to give first preference to the higher court. If both are of same level, then you have to prefer criminal court. For example, you get two summons, one from the district criminal court, another from the district civil court, then you have to go to district criminal court. At the same time, if you get a district level civil court, another is CJM criminal court, then you have to attend the civil court which is higher. At the same time, if both are either civil or criminal, then you have to attend the court whichever the court from you received the summons. Received early. Okay. I hope you got the message. Now, look at this question. I give you some time. If a witness receives two summons to attend on the same day by the following courts, he must attend civil case in Sessions Court, criminal case in CJM Court, the one he received a summons earlier, up to the witness. What is your answer? Okay. Now, Sessions Court is the higher court than CJM Court. So, you have to attend the Sessions Court. Okay, A is the answer. Now, Dan declaration, better to remember the section as per section 32 of Indian Evidence Act. Okay. Now, who can record Dan declaration? Anybody can record. Anybody. But best is magistrate. Yeah, I am happy. Most of the students are answering A as the answer. Okay. No leading questions. Leading question means the questions where it suggests its own answer, where you can answer in the form of yes or no. No leading questions. No interpretation of signs. If at all person notes his head, you have to just write the person noted his head up and down. That's all. You should not write yes or no. Okay. Witness should be present. Okay. If at all the Dan declaration invalidity, where it does not have any interpretation, then it is not valid. And it has to be submitted to the magistrate as early as possible. No need to wait till it's done. As soon as you complete recording, immediately you have to submit it to the magistrate. Now, what about the validity of Dan declaration if he dies? See now, after giving Dan declaration, it does not mean always he has to die. He may survive also. The medical legal importance. If he dies, it retains full legal validity. And if at all he survives, it loses its legal validity. Remember, if the person survives, strictly speaking, it is not at all called a dying declaration. To call it a dying declaration, person has to die actually. So, it loses validity. But it acts as corroborative evidence. Corroborative evidence in the sense, after survival, if the person changes the statement what he was already given in the dying declaration, then the lawyer may ask, okay, in that case, why did you give your statement at the time of your expected death? That is corroborative evidence. So, dying declaration can be received by any of the above. Any of the above. Okay. Now, dying deposition. Remember, it is not at all practiced in India. For India, it is only hypothetical situation. What is the difference? Dying declaration, anybody can record. Dying deposition, it has to be recorded only by a magistrate. Only by a magistrate. To say dying deposition, it has to be recorded only by a magistrate. Otherwise, it is not a dying deposition. Number two, under oath or solemn affirmation. Your oath is sworn in the name of the God that I will tell the truth, the whole truth, and nothing but the truth. Or if he is an atheist, he may say, I solemnly affirm that I will tell the truth, the whole truth, and nothing but the truth. Number three, in the presence of the accused or his lawyer. Number four, cross-examination is allowed. Cross-examination is allowed. Okay. And as I told you, it is only hypothetical situation not practiced in India. Not practiced in India. But wherever it is practiced, dying deposition has got more weightage than dying declaration because it is just like a court procedure. Okay. So it is more valid than dying declaration. And medical legal importance. Because it is just like a court procedure, whether the person dies or survives, it retains full legal validity. It retains full legal validity. Remember that. Okay. Which carries more weight in the court of law? Dying deposition. Not true about dying deposition is it is a hypothetical situation, that is true. More valid than dying declaration, that is true. It is valid even if the person survives, it is true. If the person survives, it acts as corroborative evidence, that is for dying declaration. Okay, dying declaration. The police officer recorded the dying declaration of a person. The doctor certifies that the victim was oriented and was in compos mentis. The dying declaration becomes valid if the declarant survives. See, same question asked in August 2020 examination. Okay. Now, 51 IPC deals with oath as well as solemn affirmation. As I told, there are two types of people in the world. Number one, who believes in the God, known as theist. Who does not believe in the God, known as an atheist. A theist goes to the court of law, he may keep his hand on the holy book of his religion, of his belief, and he may say that in the name of the God, I will tell the truth, the whole truth, and nothing but the truth. That is known as oath. But if you don't believe in the God, then you can say that I solemnly affirm that I will tell the truth, the whole truth, and nothing but the truth. He can keep his hand anywhere. Some people may keep his on the chest, some people on the head, some people may do like this, but don't keep in unwanted areas of your body. Just because the person is theist, it does not mean that always he will tell the truth. Just because the person is an atheist, it does not mean that always he will tell the lie. Both may lie. Lying under oath is known as perjury. That is, giving false evidence under oath or solemn affirmation is known as perjury. Here, two important sections you have to remember. Section 191, which defines perjury. 193, which gives punishment for perjury. Maximum up to 7 years of imprisonment. Maximum up to 7 years of imprisonment. Okay, remember that. Okay. Minimum age to take oath is 12 years. No need to take oath or solemn affirmation for a child below the age of 12 years. This is a very, very important question. Now, coming to the medical and ethics. As per National Medical Commission, the medical record should be maintained for at least 3 years. It's a very important question. Very important question. Okay. Just write down some points in your notes. Just write down. Medical record should be maintained as per NMC 3 years. At the same time, if at all the patient or the patient party ask the hospital authorities for the medical records, it has to be given within 72 hours. That means 3 days. This is also very, very important question. Just because it asked in EMC does not mean that it cannot be asked in FMG exam. It can be asked anywhere. Okay. Okay. Now, what is warning notice? What is warning notice? You complete your MBBS, then you are supposed to get your registration in the State Medical Council or sometimes directly from National Medical Commission. That time, they prescribe the code of conduct. So, warning notice is the code of conduct prescribed by State Medical Council or National Medical Commission. As a doctor, how you should behave with your patients, or how you should behave with your colleagues, or how you should behave with the society or the state. That is warning notice. Don't be under impression that warning notice is punishment given by the State Medical Council or National Medical Commission. It is the code of conduct. If at all you violate the warning notice, that means if you don't behave in a proper way, what is expected from a doctor, it amounts to professional misconduct. And as I already told, it is issued to all the doctors at the time of registration. Okay. It is issued to all the doctors at the time of registration. Remember, warning notice is a code of conduct, it is not a punishment. Now, if at all the doctor goes for some sort of professional misconduct, disciplinary control may be taken by the State Medical Council usually, or sometimes directly National Medical Commission also can take action. When SMC takes action, if at all a person has been convicted by a court of law on offences involving moral turpitude, or whenever some other person lodges a complaint against the doctor about the professional misconduct or of its own, known as suo motu. Now, what disciplinary action can be taken by the State Medical Council? Number one, warning. Remember, now we know the difference between warning notice and warning. Warning notice is the code of conduct and warning is a disciplinary control. Remember that. Okay. Warning. Number two, there is recent amendment after NMC, monetary penalty. Before it was not there. Monetary penalty means fine. And number three, penal erasure. That means the doctor is penalized by erasure of his name from the medical register. His name will be removed. And this penal erasure may be temporary, maybe for a period of 3 months or 6 months or 1 year or 3 years or 5 years. Or it may be permanent. Permanent. That is known as professional death sentence. Warning means they just give one warning. Look, doctor, you have done all such things. Don't repeat it in future. Nobody will bother much about that. But if the monetary penalty awarded is too high, or if the name removed, doctor is not happy, then he can go for appeal. First appeal can be done to Ethics and Medical Registration Board. Ethics and Medical Registration Board of National Medical Commission. There are 4 autonomous boards under National Medical Commission. One is Ethics and Medical Registration Board. Again, if the doctor is not happy, he can go for second appeal directly to National Medical Commission. National Medical Commission. Okay. So, remember that very well. Previously, we used to teach, or your older edition, they mentioned that appeal should be done by Central Health Ministry. But as of now, no. It is Ethics and Medical Registration Board, or second is for NMC. Professional death sentence can be passed by State Medical Council. The term professional death sentence denotes permanent erasure of the name of the RMP from the medical register. Disciplinary action against a doctor is taken by, I already mentioned, usually by State Medical Council, maybe by National Medical Commission also. National Medical Commission also. Okay. Which of the following is the disciplinary action for professional misconduct? Imprisonment by the court of law. Warning notice is the code of conduct. It is not the disciplinary action. It is issued to all the doctors. So answer is penal erasure. Penal erasure. Remember that. Very important question. Okay. Which of the following is the disciplinary action for professional misconduct? Now many people write both. You are wrong. Warning notice is the code of conduct. Answer is penal erasure. Answer is penal erasure. Okay. Now, which of the following can be disciplinary action for professional misconduct? Now, warning notice is not in the option. Warning is there in the option. So, your answer is both. Okay. Both. Warning is issued to a registered medical practitioner for, I told it is given for professional misconduct. That means unethical practice. Unethical practice. That is the best option here. Okay. Warning notice is issued to, it is issued to all the doctors at the time of registration. So answer is none of the above. None of the above. So I hope now you got the proper concept about warning and warning notice. A doctor can appeal against disciplinary action taken by SMC too. Originally, if you go through the previous books or MCQ books, then they have mentioned Central Health Ministry, but now it has been changed. Answer is National Medical Commission. National Medical Commission. Okay, National Medical Commission. Now, some student asks, disciplinary action taken by SMC with respect to a married doctor indulged in adultery. That means he had extramarital affair. Then some people answered, external affair ministry. No. Here also the answer is NMC. Here also answer is NMC. Okay. Now, here you should know basic 3 declarations. Of course, I think almost all of you know modernized versions of Hippocratic Oath comply the Declaration of Geneva. Just write down fast. Just write down Hippocratic Oath, Declaration of Geneva. Now, what about Declaration of Helsinki? See, it is easy to remember. H for H. Human experimentation. Human experimentation. Declaration of Oslo. O. Abortion. O. Oslo. Abortion. Declaration of Tokyo. T for T. Torture. Torture. Okay. So, just remember these 4. This may be asked. Now, coming to the age and consent. Very important. A child below the age of 12 years cannot give consent even for general physical examination as per 90 Indian Penal Code. Just remember, a child below the age of 12 years cannot give consent even for general physical examination by a doctor. Who can give? Parent or guardian can give as per section 89 of IPC. For NEET, they ask this section. Under 12 years cannot be given as per section 90. A parent can give consent below the age of 12 years for a child as per section 89 of IPC. Now, what about 12 to 18? 12 to 18, a person can give consent only for general physical examination, but not for pervaginal and rectal examination. Only for general physical examination. Many times people say PR and PV comes under general physical examination. No. As per this, not supposed to give consent for PV and PR. That means no blood test. You cannot draw blood. You cannot give any injection. You cannot take X-ray. Okay. So that is important question. What is the minimum age of a child to give consent for age determination? Many students say 12. You are wrong. Minimum age for age determination is 18 years. Minimum age of consent, because X-ray has to be taken. That means more than 18 years, you can give consent for any act. Any act, even major surgeries, you can give consent. Okay? Okay. You understood? Okay. Now, minimum age at which a child can give consent for medical examination is 12 years. A child below the age of 12 years cannot give consent as per IP section 90. In case of child below the age of 12 years, the parents of guardian can give consent as per IP section 89. Already I told. Minimum age of a person who can give consent for age determination is 75% of the students mention 12. You are wrong. The age is 18 years. 18 years. Consent is not required in case of emergency. What do you mean by emergency? For example, a child of 8 years comes to your doctor with severe chills and rigors. You suspect malaria. Nobody is there to give consent. Then you can proceed with the treatment even without consent as per section 92 IPC. Or number 2, person is incompetent to give consent. Incompetent to give consent. When he is incompetent to give consent, maybe because he is unconscious, or maybe because he is intoxicated, or maybe because he is mentally ill. As you know very well, 90 IPC, consent by a child below the age of 12 years is not valid. Consent given by intoxicated person is not valid. Consent given by mental ill person is not valid. In such cases, doctor can continue with the treatment or management even without the consent. Now, this is a very interesting question. Look here. A person presents with crushing injury of both lower limbs in an emergency and refuses to consent for surgery. Many students have misunderstood that any case of emergency, doctor can proceed without consent. It is not like that. Either person should be unconscious or he is incompetent. But in this particular case, person is conscious. Person is conscious. So, answer is, doctor cannot operate on the individual. Even though it is a case of emergency, person is conscious. You understand? Okay, that's very important. Now, look at this question. Person is unconscious, has got extradural hemorrhage, not able to give consent. Then, as per 92 IPC, he can proceed. He can proceed. Okay. A 8-year-old child comes to the doctor with severe chills and rigors. As I said, treat without consent. Treat without consent. No problem. A 40-year-old victim, intoxicated. Emergency surgical intervention is required. Again, operate without consent. Operate without consent. Okay. Now, very, very important concept. Vicarious liability or vicarious responsibility. Most of the students will be confused. What is the difference between vicarious liability, borrowed servant doctrine, captain of the ship doctrine? I tell you, if tomorrow I do some negligent act, I am liable for punishment, maybe in the form of criminal negligence or civil negligence, where I have to pay the compensation. The vicarious liability comes under civil cases where not the one who is negligent, but some other person is held liable to pay the damages in a civil suit. Here, what you have to remember is not for criminal liability, only for the payment of damages. Damages means compensation. Damages is a legal term. Damages means compensation. Not the one who is negligent, but some other person is held liable or responsible to pay the damages in a civil suit. Civil suit under the principle of Respondeat superior. Respondeat superior. So, for example, tomorrow my son of 5 years old throws stone on a glass window of my neighbor. I am responsible to replace the glass window. Why? Because my son is not in a position to pay. Okay, and here it is based on the fact, let the master answer. Let the master answer. Who is the master? Master is the employer. So that means employer is responsible for employee's negligence. Employer is responsible for employee's negligence. Okay. Okay. If you have not understood, I give you the examples. A doctor is not actually negligent, may still be held responsible in civil negligence. So, based on the doctrine of, answer is vicarious liability. Not true for vicarious liability. Yes, there must be employer-employee relationship. True. Employee's conduct must occur within the scope of his employment. The negligent act should take place during his employment. Employee's negligence must occur while on the job. Yes, employer must be negligent. Wrong. Wrong, wrong, wrong. Okay. Now, for example, I just give in an RTA scenario. RTA scenario. I drive my car alone. See, listen carefully now. Here, you have to answer. You have to understand. Once you understood, definitely you will answer. Me alone in my car. I hit one pedestrian. Pedestrian dies or sustain injury. Who is liable to pay damages? Civil means payment of compensation. Criminal means to go for imprisonment. Just remember, civil compensation, criminal imprisonment. Okay. Now, me alone in my car, I hit one passenger, this pedestrian. I have to pay the compensation. I have to go to jail. Okay. See, some students are written there. What is the answer? You cannot see all the options. See here, basically, I am teaching you the concept. Once you understand the concept, depending on the same question has been framed, you try to understand the concept. No need to go through all 4 options. Okay, and I told you clearly, you will get the recorded. You can keep the pause. You can keep in pause and you can go through that. Okay. Because I want to teach as much as possible. That is my basic idea. Otherwise, why should I go fast? Do you think I am in a hurry? Nothing like that. If my marriage is at 7 o'clock, now I have to finish at 6:55, then I agree. Nothing like that. I am totally free as of now. Okay. I am going fast because it is revision. It is like quick revision program. Number 2, already you are in the fag end of your revision. You are going for examination. You are almost become a master in the subject. At the same time, you have an option of going through the recorded videos. Don't ask me to go slow. Okay. Now, me in my car with my driver while driving hit one pedestrian and pedestrian dies. Who has to pay the damages? Tell me, who has to pay the damages now? Give me the answer. Give me the answer first. Civil. Who is responsible? Tell me. First. There is some small lag here between my teaching as well as the videos. Okay. Civil. Me. Because I am the employer, he is the employee. Chill. Criminal. Driver. You understood? My driver alone in my car on duty. He is under my duty. Civil, again, me. Criminal, again, he. My driver in his car, not on duty, is driving his own car. He may be my employee, but he is driving his own car other than for my job. Now, both civil and criminal, driver is only held liable. driver is only held liable. Okay. So I hope all of you understood properly. Okay. Okay. Now, in a hospital scenario, see, this is very, very important. See, I'm taking some time for this because it is very much concept oriented. In a hospital scenario, you imagine I am the owner of the hospital. I am the owner of the hospital. Okay. And I have employed all these employees. So many other doctors, the nurses, the lab technician, CT scan technician, security guard, sweeper, everybody. Now, if any one of these person does any negligent act, who is held liable according to you? Who is held liable according to you? Tell me. Tell me, man. Tell me. Who is liable? I am liable. I am liable. Because I am the employer. That is employer-employee relationship. I have to pay the damages. Damages means compensation. Damages means compensation. Okay. Now, again, briefly I tell employer, employees, doctor, nurse, technicians, etc. Negligence by any of the above, employer is responsible to pay damages and employee is responsible for criminal liability. Take one screenshot of this in your mobile. Very, very important. Very, very important. Okay. Now, what do you mean by borrowed servant doctrine? Borrowed servant doctrine. Here, if an employee is borrowed from the principal employer, then the temporary new employer will be held liable for any negligent act of the employee. Okay? Are you have you understood or understanding or you will understand? Tell me. I will tell you. It is very, very easy. I give you example. Look here. Me in my car with my driver. My driver is driving the car. Civil, me. Criminal, driver. Already you understood. Okay. Now, your dad is my friend. Okay. Say, for example, I am taking class for NEET PG face to face in one particular city. Your dad comes to know that I have come there, he comes to meet me. Then we decide that we'll have dinner in the night together. Then I ask, where are you going? And he says that he's supposed to go somewhere 50 kilometers away. Then I say, why can't you take my car and my driver? Now, your dad borrows my car with my driver. Now, my driver, in which car your father is going, hits one pedestrian dies. Now, who is liable to pay the damages, whether it is me or your dad? Don't be under bias because he is your dad. Okay? Tell me. Hey, tell me, I say. Tell me fast. Don't get biased. I am telling you, don't get biased. Okay? Who? Your dad, man. Your dad, not me. Because here, your dad has become temporary new employer. Okay? Criminal driver. I hope you understand. In a hospital scenario, again, imagine I am the hospital owner. I am the hospital owner. She is my employee. This nurse is my employee. One visiting surgeon who is not my employee. A visiting surgeon comes to my hospital to do some surgery. He is not my employee. During surgery, that visiting surgeon borrows my OT nurse. Now, during surgery, my OT nurse does some negligent act. Okay? Now, who is liable? Who is liable whether it is me or visiting surgeon. Who is liable now? I told you clearly, this visiting surgeon is not my employee, but he borrows my servant. That means this visiting surgeon has become temporary new employer. I am not held liable to pay the compensation. The visiting surgeon has to pay the compensation. Okay. So, I hope you understood about borrowed servant doctrine. Again, I give example. Hospital employer, nurse employee, visiting surgeon, not the employee of the hospital, borrows nurse's service during surgery, negligence by the nurse, visiting surgeon is responsible to pay the damages, nurse is responsible for criminal liability. Okay, now you just send me the messages. Yes or no. Yes means you understood, no means you are not understood. I want 90% yes answer. Okay, tell me. Tell me yes or no. Yes or no. No answer. Yes, 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 yes. No, 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 yes. Anyway, now coming to the captain of the ship doctrine. Okay. Okay. Majority of you have written yes. If you have not understood, if you have written no, please listen to this class again. Simple. Cool, cool, cool. As I say, cool, baby, cool. Okay. Captain of the ship doctrine. Head of the team is answerable for his subordinates' negligence. Head of the team is answerable. Here you see, I have not written liable, I have not written responsible, I have written answerable. Answerable, not liable or anything. Okay. Now, in a hospital scenario, again, I am only the owner and one surgery is going on with the chief surgeon. Okay, some negligent act take place during the surgery. Remember, I am the owner. I am the owner. There is a chief surgeon with a surgical team. Some negligence takes place. Now, the chief surgeon is answerable to me. Is answerable to me. Understood? Okay. You understood? Answerable, not liable. In such scenario, the one who has committed the negligent act is liable criminally, and I am liable for the payment of damages. You understood? Finally, I give one more example, that is the end of that. Law does not consider the following doctrine in charge of criminal negligence. As I told you, vicarious liability is only for civil cases, civil negligence. Only for civil negligence, only for the payment. Remember, criminal negligence does not consider. Vicarious liability is not for criminal cases. Vicarious liability pertains to, again here 90% of the students give the answer D. Responsibility for action of junior. You're wrong. I never use the word senior and junior. I never use the word senior and junior. What word I use? I used employer and employee. Who is the employer? Hospital. So answer is hospital's contribution towards patient damage. Patient damage. Okay. Understood, man? Not only man, woman also. Woman, if girls, if I say woman, you'll be angry. Okay, girls, boys, ladies, females, males. Understood? Okay. Respondeat superior pertains to hospital's contribution towards patient damage, because vicarious liability and respondent superior both are same only. Okay. Now, finally, I give an example. I think all of you have to understand. Okay, look here. A junior surgeon has performed appendectomy and leaves an artery forceps in the abdomen in a hospital where he has been appointed. The patient files a case in a court of law. In such scenario, owner of the hospital is responsible for the damages. Okay, try to understand this properly. Owner of the hospital has to pay the compensation under respondent superior or vicarious liability. Vicarious liability. Chief surgeon is answerable to the owner. Captain of the ship doctrine. Chief surgeon is answerable. Junior surgeon is responsible for criminal liability. Junior surgeon is responsible for criminal liability. Okay. That is because of criminal negligence. Criminal negligence. I hope all of you understood properly. Okay. No more. You take a screenshot of this. A junior surgeon has performed appendectomy leaves the same question. Who is responsible for damages? Means compensation. Owner of the hospital. Who is responsible for criminal negligence? Junior surgeon. Okay. Doctrine of borrowed servant is applicable on a nurse employed by hospital, assist in operation by a surgeon who is not that hospital's employee. That is the answer. That is the answer. Understood? Understood? Okay. Which IPC section is related to medical negligence? My dear students, remember, section 300 of IPC defines what is murder and what is culpable homicide not amounting to murder. Section 302, punishment for murder. Section 304A, rash and negligent act resulting in death of a person. Rash and negligent act resulting in death of a person. 304B, dowry death. Dowry death. Dowry death. So answer, already students are given answer. Majority, almost all has mentioned 304A. Good. What do you mean by? Today in my Telegram group, somebody asked, sir, what is the difference between Morrison's rule and Hassey's rule? Estimation of gestation age by crown, heel, land. Crown, vertex, heel, You measure the length. If the length of the fetus is less than 25 centimeter, take square root of crown, heel, length. If the length is more than 25 centimeter, divided by 5. That gives the gestational age in lunar months. Lunar months. Simple. Say for example, length is 9 centimeter. Gestation age is 3 centimeter, 3 months. Lunar months means 4 weeks. 1 lunar month is equal to 4 weeks. Rule of Hassey is used for estimation of gestational age. Gestation age of a fetus of CHL 16 centimeter is 4 months. 4 months. Square root of 16. 4. If the CHL is 35 centimeter, then you use Morrison's rule divided by 5. Answer is 7 months. 7 months. Up. Sir Edmund Locard. Very important question. Sir Edmund Locard is important or very well known for 2 things. Number 1, Locard's principle of exchange. Whenever two objects come in contact with each other, always there is transference of material from one object to the other. Whenever two objects come in contact with each other, always there is transference of material from one object to other. That is Locard's principle of exchange. For example, white car hits with black car, black paint seen on white car, white paint seen on black car. That is Locard's principle of exchange. Locard's method, all of you know fingerprints. Even in the finger ridges, there are multiple pores, which are nothing but the opening of the mouth of the sweat ducts. Study of opening of the sweat ducts on the finger ridges is known as poroscopy. Poroscopy. And it is useful when fragmentary fingerprints are available. Okay? Fragmentary fingerprints are available. Okay. Which technique involves reading offset glands on ridges of the fingerprints? Poroscopy. Sir Edmund Locard in forensic medicine is famous for principle of exchange. Mutual transfer of material from one object to the other is known as Locard's principle. Sir Edmund Locard is known for poroscopy. Poroscopy is discovered by Sir Edmund Locard. Edmund Locard. Okay. What is podogram? Study of footprints. Just running words. Podogram means study of footprints. Okay. Rugoscopy means study of palatal rugae. And here one important question. Anterior one-third of the palate is preferred. Anterior one-third of the palate is preferred. Just remember, palatoscopy means study of rugae in the palate. Study of palatoprints is known as rugoscopy. Rugoscopy. Poroscopy, already you know. Oroscopy means looking into the mouth. What is cheloscopy? Lip prints. I will show you. Palatoprints for identification. Which area of the hard palate? Anterior part of the hard palate. Cheloscopy means lip prints. Cheloscopy means lip prints. Okay. Study of lip prints is known as cheloscopy. Okay. Now, tattoo marks, there are 3-4 important questions. What is the ideal depth for permanent tattoo? See, if it is in the epidermis, wear and tear, it goes. If it is in the deeper layer of the dermis, it will be taken away by the phagocytosis. If it is beyond the skin, who can see? Only the muscles can see. So, ideally, superficial layer of dermis. Ideally, superficial layer of dermis. Okay, yeah, you see, many students are writing D. What man, if it is beyond the skin, who can see? Only the muscles can see. Okay. The ideal method to recognize latent tattoo. Latent tattoo means what? Tattoo is there, but it is not visible. Invisible tattoo. Here, the answer is ultraviolet light. Latent tattoo can be visualized by passing ultraviolet light. In case of dead, at the same time, if the tattoos are faded, it is made visible by infrared rays. That is given in recent edition of Naran Reddy. So, latent tattoo, ultraviolet, faded tattoo, infrared. In case of dead body, if at all history says there is tattoo on the forearm, you have to take the biopsy of the axillary lymph nodes. If it is on the face, cervical lymph nodes. So, regional lymph node biopsy is done in case of dead bodies. Laser is the best method to remove the tattoo. Best method to remove tattoo is laser. Okay. In a dead body, if the tattoo marks are destroyed, their presence can be inferred from presence of pigment in regional lymph nodes. Regional lymph nodes. Now, what do you mean by negative autopsy? Absolutely no findings after external and internal examination. You have seen externally A to Z, no findings. Open the cranium, thorax, abdomen, no findings. You send the viscera or organs for histopathological examination, no findings. You send the viscera for toxicological analysis or chemical analysis, no findings. Absolutely no finding. Opinion as to the cause of death cannot be given at all. Okay? Absolutely no findings. Remember, opinion as to the cause of death cannot be given. Okay? When, for example, person dies of vagal inhibition, a person dies of laryngeal spasm, absolutely no findings, even after autopsy. Why? It is due to functional failure of a vital tissue. Okay? Functional failure of a vital tissue or organ, then it is known as negative autopsy. In negative autopsy, death represents the functional failure of a vital tissue or organ. What is obscure autopsy? Many times students get confused between obscure autopsy and negative autopsy. In obscure autopsy, there are minimal findings, but these minimal findings are not clear cut. But you cannot correlate with the cause of death. You cannot correlate with the cause of death even after external internal examination, histopathological examination, and chemical analysis. Remember, opinion as to the cause of death cannot be given. So, opinion as to the cause of death cannot be given in both obscure autopsy and negative autopsy. Look here. Now, what is the difference between these two? You see here, see the slide. Negative, absolutely no findings. Obscure, minimal findings. That is the difference. What are the common features? Opinion cannot be given. Okay. For example, imagine I receive a dead body to my mortuary. I examine it to Z. No. Inside, no. Histopathology, nothing. It is negative autopsy. At the same time, I open the cloth, I see one abrasion of 10 into 10 centimeter over right upper abdominal wall. 10 into 10 abrasion. Then I suspect there must be blunt injury to the abdomen. Rupture of the liver may be the cause of death. But on opening the abdomen, absolutely nothing is there. But can I say that death is due to abrasion? No. So I can't say negative autopsy also because there is abrasion. Now I call it as obscure autopsy. Okay. If the cause of death is unknown, even after detailed examination and investigation, so in this question, only thing what I said is cause of death is unknown. They never mention about the findings. So, best answer is either A or B. Either A or B. Remember that. Okay. Remember that. In an autopsy, if there are no findings even after detailed examination and investigation, here what is mentioned? No finding. Your answer should be negative autopsy. See the third question. Minimal findings but cannot correlate with the cause of death. Your answer should be obscure autopsy. See, there is a difference between these three questions. Incomplete or inadequate training of the doctor can result in. Strictly speaking, I don't agree with this question. But answer expected is negative autopsy. Here what they say, if at all you are one of the total useless doctor or useless forensic expert, even though there are some findings, you could not get that findings, then you give your report as negative autopsy. That's all. Okay. What is virtual autopsy? Virtual autopsy means radiological autopsy. It does not mean only CT and MRI. They may use CT scan, MRI, ultrasound, X-ray, anything. Other day somebody asked a question in my Telegram group. In that question, one of the following is not including virtual autopsy. They wanted X-ray as the answer. Nothing like that. Virtual autopsy means radiological autopsy. Okay. Usually CT and MRI. Even if they suspect some fracture, you can take X-ray. Why you want CT and MRI? Non-invasive postmortem examination is virtual autopsy or autopsy. Okay. Now, another most important is techniques of autopsy. Different techniques of autopsy. Here again, some people have confused the students. Number one, Lettuce technique. Lettuce technique is also known as N-mass dissection or N-block dissection. N-mass or N-block. Now the thing is, many examiners and even textbooks of reputed authors, they have mentioned N-block is Gauss technique. That is wrong. You see the dictionary meaning. N-mass or N-block mean all together or all at the same time. Even one of the fantastic book you can consider, Burnham Knight textbook, you can consider equivalent to Harrison in General Medicine. Even he has mentioned organ removed N-block is Lettuce method. Okay, I am giving proper reference also. Don't scold me tomorrow. JP sir taught us wrong. No. Okay. A to Z, oral, cervical, thoracic, abdominal, pelvic, A to Z removed as a single large organ block. In Lettuce technique, cervical, thoracic, abdominal, pelvic organs are removed as one large organ block. That is Lettuce technique. Lettuce technique. N-mass removal autopsy is called Lettuce technique. Lettuce technique. N-block removal at autopsy is called Lettuce technique. It is commonly done in medical colleges to teach UG and PG students. Okay. The autopsy technique commonly used in medical colleges is Lettuce. Lettuce. Number two, Gauss technique. What is Gauss? It is known as block by block dissection. Some authors and teachers confuse between N-block and block by block. Here, cervical and thoracic organs has one block, abdominal has another block, urogenital has another block, or in other words, tomorrow you can take hepatobiliary system as one block, urogenital system as another block. It's like that. That is known as Gauss technique. So here the answer is cervical and thoracic organs, abdominal organs, erogenous system are removed as separate organ blocks. At autopsy, block by block dissection is known as Gauss technique. Gauss technique. At autopsy, unblock dissection means all together. Don't get confused between block by block and N block. Okay. Which among the following is the N-block method used in autopsy? Chipmer. Lettuce technique. It is not Gauss technique. Lettuce technique. Workhorse technique. Organ by organ removal, it is most common method in India. You remove the brain, you remove the heart, you remove the right lung, you remove the left lung, you remove the right kidney, left kidney. One by one you remove. Okay, here organs are removed one by one. One by one. The most common autopsy technique in India is, which is the most common autopsy technique in India? Most common is Workhorse. Organ by organ removal. Rokitansky technique means in situ dissection, where you are scared to open the handle the body too much. Say, for example, COVID-19 case, HIV, HBsAg. You just open the cavity. Don't manipulate too much. That is known as Rokitansky technique done in infected cases or suspected infection cases. So, Rokitansky disease in situ dissection is done. The autopsy technique used in case of infected case is Rokitansky. Which of the following is correctly matched? Rokitansky in situ. Gauss N block. Some people had confusion between A and C. C is wrong. Gauss is block by block. Many times people ask, is there any mnemonic? You can say, don't worry, GB lay. Don't worry. Worry, you just wrote, I just wrote VORI. V Workhorse, organ by organ. R Rokitansky, I in situ. G Gauss, block by block. L Latules, N mass or N block. Okay. In autopsy, two types of preservative you should know. Preservative may be used for chemical analysis as well as histopathological examination. For chemical analysis, it may be rectified spirit or supersaturated sodium chloride. Histopathology, 95% alcohol or 10% formalin. This is basic. Okay. Now, always remember, alcohol is the best preservative. So, best is rectified spirit or 95% alcohol either for chemical analysis or histopathology. But problem is, even though alcohol is the best preservative, it is very difficult to preserve the preservative. The class 4, class 3, class 2, your professor and HOD only may consume rectified spirit or 95% alcohol. So, most commonly used is supersaturated sodium chloride or 10% formalin. 10% formalin. Supersaturated sodium chloride means common salt. Okay. Never ever use formalin for chemical analysis. Soft tissue samples for histological examination are preserved in formalin. Okay. Commonly used for HPE, histopathologic examination, is formalin. Preservative generally used for preservation officer in a case of suspected poisoning for chemical examination is saturated solution of sodium chloride. What is the ideal source for DNA extraction? This question may be expected. It depends. If the body is fresh, just write out DNA. Fresh body, blood is best. In a fresh body, blood is best. Okay. Blood is best. Okay. Sorry. Okay. In case of early decomposition, best is skin. Best is skin. Second best is, sorry. Best is muscle. Second best is skin. Third is spleen. Okay. See, previous editions used to say spleen is the best. Present editions say muscle is the best. But Dr. Anil Agarwal has mentioned skin in between muscle as well as spleen. Okay. So, best is muscle. Next is skin. Thirdly, spleen. In case of DNA testing, which tissue sample is taken at autopsy? Liver, spleen, kidney, muscle. Best is muscle. Best is, okay. For DNA testing, which tissue sample is taken at autopsy? Now, muscle is not there. This is an old question. If muscle is not there, your answer should be spleen. Okay. Late decomposition, as you know very well, bone, especially femur, or teeth, especially molars, or hair root sheath. Hair root sheath. Okay, that is in case of late decomposition. Again, if you want to know which is best out of these three, definitely femur because it has more bone marrow. Okay. Which of the following is not a potential source of DNA for forensic analysis? Remember, DNA fingerprinting can be done, profiling can be done only by nucleated cells. Only by nucleated cells, not by RBC because it is non-nucleated. Now, briefly about railroad phenomena or trucking or Kevorkian sign. Remember Kevorkian sign. Once the person dies, the blood cells get coagulated, alternated with serum. It looks as if trucks parked one behind the other when you see through the ophthalmoscope. That is known as a railroad phenomenon or trucking. Okay, railroad phenomenon or trucking or Kevorkian sign. Okay, just remember that. It is seen in the retina. What is sticky nor sclerotic? Okay, look here. If the eyelids remain open after the death, the cellular debris and foreign bodies get settled as a triangular patches on both sides of cornea in about 3 to 4 hours. That is known as tachynoid. Tachynoid. Initially it will be yellow, then it becomes somewhat dark brown and black. So what you have to remember here is, don't get confused between trucking and tachynoid. Trucking is seen in retinal arteries. This is seen in the sclera in the eye. Okay. Tachynoid sclerotic. Not true regarding the conditions shown in the image. First, you have to identify what is the image. Image is tachynoid. Seen only when the eyes remain open after death. That is true. Due to deposition of foreign bodies and cellular debris. That is true. Seen in 3 to 4 hours after death. That is true. Seen due to phenomenon of trucking. That is wrong. Trucking is different. Hypostasis. All of you know, now the easiest question, once the person dies, there is no circulation. Blood flows into the dependent parts of the body and stains the skin, maybe internal organs. Known as hypostasis or postmortem liability, postmortem staining. Suggelation in Ames question, always they ask, what is suggelation? Okay, that is hypostasis. See this question asked in Ames 2018. Identify. It is suggelation. At the same time, some important, whichever I have given in red, what are the color changes in postmortem lividity? Remember, normal bluish purple, forget about that. All of you remember, carbon monoxide poisoning, it is cherry red in color. Cyanide poisoning, bright red in color. In hypothermia, bright pink in color. Phosphorus, dark brown in color. Nitrites, reddish brown in color. Reddish brown may be in nitrates, maybe in aniline, but sometimes it may be deep blue. Many times they ask in the past, deep blue hypostasis is seen in aniline poison. Whenever it is green, hydrogen sulfide. Okay, I just give you one list. Okay. See, in my Telegram group, I have given multiple PDF in files. In my Telegram group, as I said, at the rate of forensic JP, you go to files, then you get multiple PDFs. There I have given this. Okay. A dead body is having cadaveric liability of bluish green color. The most likely cause of death is by poisoning due to bluish green hydrogen sulfide, dark brown phosphorus, reddish brown nitrites, deep blue aniline is the best answer. Aniline is the best answer. Okay. Rigor mortis first occurs in, all of you know, it first occurs in the heart. Overall in the heart. External, it first occurs in upper eyelid. See, heart, Indian books say 1 hour, foreign books say half an hour to 1 hour. Forget about that. But the question is, there is some confusion because of the ignorance and jugglery of English. See here, rigor mortis first occurs in heart, you agree. Rigor mortis first commences in heart, you agree. Now, rigor mortis first appears in, what is your answer? What is your answer? Now, immediately say appears in upper eyelid. You are wrong. Your answer should be heart only. Forget about this question. Rigor mortis first seen in. Again, I have seen somebody set the explanation. People say that first seen in upper eyelid. You are wrong. Answer is heart. You know why? I tell you frankly, rigor mortis cannot be seen. Say for example, imagine I am dead. My eyes are closed. By looking at my eyes, how can you say that there is rigor mortis? You cannot see the rigor mortis. You have to come, try to open my eyelids. Or imagine that rigor, you have to come and feel. You have to come and feel. That means rigor mortis cannot be seen. It has to be felt. Just like yesterday in my group I said, rigor mortis is like love. You cannot see the love. You have to feel the love. How can you see love? Your father say, I love you. Can you see his love? No. But he can feel the love by his body language. Okay. You can see the love only when somebody's name is love. Then you can see love. If his name, oh, I am seeing love. You can see. Otherwise, no. So answer is heart only. Okay. Marbling is very, very important. Staining of the walls of the superficial veins by self-methemoglobin. Many times they ask marbling, especially in AIMS, even FMGE, NEET, everywhere they are asking. Remember, it commences in about 24 hours and become prominent in 36 to 48 hours. 36 to 48 hours. So, if it was a question asked when you can see marbling, or when you can notice marbling, your answer should be 36, not 24. 24 it commences, but it is not well visualized. Okay. Seen most clearly on the thighs, side of the abdomen, chest and shoulders. Forget about this. This is not much important. I will show you. See here. Marbling. Staining of the superficial walls of the venous system. Which means superficial veins. Up. Initially it will be red, later it becomes green. Initially red, later green. See, this is another case. Marbling. Another case, marbling. See, it is a mosaic pattern. Mosaic pattern. Venous network. See, marbling. Okay. See, marbling. See, marbling. All these different pictures. Marbling is due to veins becoming visible due to decomposition of blood. Which of the following is the reason for marbling? Self-hemoglobin. If self-methemoglobin is there, that is the answer. If they split into self-hemoglobin and methemoglobin, your answer should be self-hemoglobin. Marbling is noticed by 36 hours. 36 hours. The following patient was brought for an autopsy. What is the cause of the discoloration of the region plotted in the arrow? Self-methemoglobin. Okay. Self-methemoglobin. The postmortem changes seen in the image corresponds to which of the following? Marbling. Okay. Identify the condition shown in the image. See how many times we ask in inset as well as IMS. Marbling. Now, what is filigree burns? Filigree burns. This is filigree burns. Filigree burns are seen in lightning. It is because of the rupture of the RBCs where you can see branches of tree-like appearance. You see exactly the difference between marbling and filigree burns. Filigree burns, the lines are exactly like a branches of tree. It is not marbled appearance or mosaic appearance. It is thinner lines, very thin. Okay. And there is no discoloration like what you have seen in marbling. Now you see all upper pictures are filigree burns, all lower pictures are marbling. Marbling. Okay. Okay. Look here. What it is? Branches of tree-like appearance. This is again a case of filigree burns. True regarding the change seen in the image due to vascular disease. Wrong. Due to self-hemoglobin. True. Due to non-bacterial cause. Wrong. Seen within 24. No. First you have to identify this is marbling. It is due to self-hemoglobin. Look at this picture. Battle sign. They may give this image. Identify. Battle sign. See, generally what happens? If I hit a person on the forearm, you are supposed to get a contusion on the forearm. Sometimes, area of impact may be one's place. Appearance of bruise may be in some other place. For example, if at all there is impact on the forehead, there may be black eye. If there is fracture of the middle cranial fossa, it may give rise to the bluish or reddish discoloration on the mustard area known as battle sign. Now, sometimes they may give images of lacerated wound, incised wound, different types of lacerated wound. Let me go on that. Look here. What exactly the difference? See, lacerated wounds are always caused by blunt weapon. If at all I take a stone and hit on a person, the skin invaginates, and if the force of impact is too much, skin splits. Skin splits. Look here. Once it splits, look at the margins. Irregular. Margins are irregular. The invaginated skin comes in contact with the edge of the stone. So edges are contused or bruised. Bruised. And neurovascular bundles are intact because of the elasticity of the neurovascular bundles like artery, vein, lymphatics, nerves. Intact. Okay. So look here. This is the diagrammatic representation where you can see the neurovascular bundles are running across the wound. So as you see here, margins are irregular, edges are contused or abraded, neurovascular bundles are intact, then it is known as lacerated. Look here. As soon as you see the picture, you can see the neurovascular bundle. Without looking at anything, you can say that it is a lacerated wound. Okay. What about incised wound? Incised wounds are caused by sharp cutting light weapon like a blade. Once you draw the blade across the skin, what happens? It cuts the skin neatly. So margins are regular. There is no invagination of the skin because it is a light weapon. Edges are not bruised. Till the depth the blade passes, all the neurovascular bundles are dissected properly. So here in incised wound, this is the diagrammatic representation. It is so neatly cut. So margins are regular, edges are not bruised, neurovascular bundles are not intact. Okay. What about chop wound? Chop wounds are caused by sharp cutting heavy weapon, like an axe. If you take the axe and hit on a person, the sharp margin of the blade cuts the skin regularly, but the invaginated skin comes in contact with the edge of the blade, which give rise to bruise. Look here, one side the margins are cleanly cut, that means regular, edges are contused, it is known as chop wound. Now we know the difference between lacerated wound, incised wound, chop wound. Whenever lacerated, whenever the margins are irregular, it has to be lacerated wound along with intact neurovascular bundle. If the edges are clean or regular, look at the if the margins are regular, look at the edges, whether it is contused or not. If it is contused or abraded, chop wound. If not, incise. See, this question was asked in AIMS examination. The following patient has what type of injury? What type of injury? Okay. So here, you look at the margins are regular. Look at the edges, abraded or even contused. So it has to be. Our neurovascular bundles also not intact. It is a chop. It is a chop. Okay. I hope you understood about this. Identify the type of injury. You can see the neurovascular bundle. Answer is laceration. Match the following column. Lati may cause tram line bruise. You can see a bruise, two parallel bruises with a central pale area that is known as tram line bruise. Road traffic accident. Person falls from the bike, slides against the rough road and sustain graze abrasion. Blade, sharp cutting light weapon causes incise wound. Incise wound. Axe, sharp cutting heavy weapon. It may cause chop. Chop. Okay. See, here I am just showing you for identification. In FMGE, they don't ask match the following column like that. Rarely they may ask also. Okay. You understood? Now, sometimes they give you different types of lacerated wound. How do you classify lacerated wound? Number one, split laceration or incisive looking lacerated wound. Imagine I take iron rod and hit on a person on the forehead perpendicularly. Perpendicularly. Now, skin just splits. That is known as split laceration, which is seen on skin where it is underlying by bone, like skull, bridge of the nose, zygoma, chin, angle of the face here, lower part of the ramus of the mandible, or even chin, iliac crest. You can see incise looking lacerated. Okay, perpendicular force. Identify the type of the injury. Incise looking lacerated wound. Incise looking lacerated wound. Number two, stretch laceration caused by tangential force. If the force has impact is oblique, skin stretches, at last it splits, give rise to stretch laceration. You can say this particular injury directed below upwards. Okay. Understood? Look here. I can see the direction. See here again, direction. See here again, direction. Below upwards. Okay. Now, directed below upwards. Stretch lacerations are caused by tangential force. Avulsion laceration or degloving laceration or fleeing laceration, shearing laceration. Here, Force of impact is almost horizontal. For example, imagine you are traveling as a front seat passenger in a car, sudden impact, your forehead bangs against the dashboard. Your entire scalp may come out as if you are removing a dosa from the tawa, or maybe chapati, roti from the tawa. Okay, that is avulsion laceration. See, here usually skin gets avulsed along with subcutaneous tissue. As you see here, normal skin comes out along with the subcutaneous tissue, which may expose the muscle fascia. Sometimes there may not be muscle like anteromedial aspect of the leg. It exposes the bone, or even in the scalp, it exposes the bone. Okay. This picture depicts fleeing laceration. Fleeing laceration. Number 4, tear, irregular force. Say for example, if a person falls from the height on multiple small stones, or if he falls on a broken earthenware pot, multiple small laceration may be seen. That is tear. Tear lacerations are caused by irregular force. Irregular force. Force applied irregularly cause tear laceration. See, so many questions may be asked. Initially, I have seen some students, sir, discuss MCQ. Like this only, I am discussing MCQ. Okay, along with the pictures. Imagine a lorry tire passes over the legs, or your hand gets stuck in a machinery. That is crush laceration. Crush laceration. That is the classification of lacerated. Okay. Now, what do you mean by swallowtail? What do you mean by swallowtail? See, in swallowtail, there is tearing at the ends at angles diverging from the main one. Look at this lacerated wound. Here, there is no swallowtail. Look at this wound. You see, there is a tear at the end diverging from the main one. As you see, as shown in the arrow, that is known as swallowtail. Look at this picture, swallowtail. Just remember, swallowtail may be seen in case of lacerated wounds. That's enough. Okay. There are 3 tails in injuries. Why it is called swallowtail? Because they compared this with the tail of a bird called swallow bird. Swallow bird. That's why it is known as swallowtail. Swallowtails may be seen in lacerations. Lacerations. Hesitation cuts. If the person wants to commit suicide by cutting his wrist or throat, before gathering sufficient energy, he may go for multiple small tentative cuts. It indicates suicidal manner. Suicidal manner. Okay. Now, you can see, if at all you take a blade and cut your skin, as you go away from the body, the wound becomes very, very superficial and you can see only a scratch abrasion. That is known as tailing of the wound. So, tailing of the wound is seen in incised wounds. Okay, incised wounds. Single-edged knife normally cause triangular or wedge-shaped wounds. What FMGE? Sir, please let us give the answer of questions. I am giving answer along with the questions, I am marking the question, answer. Okay. Or sometimes it may be teardrop sign, shape, or raindrop shape. Okay. Single edge knife cause triangular or wedge shaped, or it may be teardrop or raindrop. Okay. What is fishtailing? Sometimes The blunt edge of a single-edged knife may tear the skin in the shape of the tail of the fish, known as fish tailing. You see here, normally it is supposed to call wedge-shaped wound. Sometimes there may be a tear. That is known as fish tailing. Okay. Now we know three tails: swallow tail, tailing of the wound, and fish tailing. Swallow tail in laceration, fish tailing in stab wounds with a single-edged knife, and tailing of the wound in incise wounds. Fish tailing may be seen in stab wound by a kitchen knife. Stab wound by a kitchen knife. Kitchen knife means single-edged knife. Okay. Double-edged knife always, it causes a spindle-shaped wound. Spindle-shaped wound. Double-edged knife. Always spindle-shaped. What is harakiri? One of the oldest question asked in IMS. Some people believe sun as the god. They sacrifice themselves by taking a sharp weapon like a knife. They may cut open the abdomen, put their fingers inside, pull out the intestine forcibly, and they die of sudden cardiac collapse. Sudden cardiac collapse. That is known as harakiri. Harakiri. It is a form of suicide by stabbing into abdomen and pulling out the intestine. Harakiri is a form of suicide that consists of cutting the abdomen with a sharp weapon. Abdomen with a sharp weapon. Harakiri, a method of suicide, is committed by ripping open the abdomen. Ripping open the abdomen. Okay. What is Pape's rule? What is Pape's rule? Pape's rule. Don't be under impression Pape's rule is only for gunshot wounds, but usually in gunshot wounds, see, a fracture line will not cross an already existing fracture line. That is known as Pape's rule. That is known as Pape's rule. Okay. A fracture line will not cross an already existing fracture line, which helps in the determination of the sequence of shots fired. Which helps to determine the sequence of shots fired. For example, imagine there is a crack in the wall of your house, horizontally situated. If another crack starts perpendicularly, it does not cross the already existing crack because energy is dissipated. One more crack comes from the side, it stops. If at all I come to your house and see these three cracks, I can say horizontal is formed first, the vertical is formed second, oblique formed third. That is Pape's rule. For example, look here. Now there are 3 bullet injuries, wound of entry, which is caused first, which is caused second, which is caused third. Now you see the violet line is stopped by the red line. That green one stopped at violet. So red is first, 2, 3. Okay. That is Pape's rule. Pape's rule. Okay. An autopsy of performed in a case of accident death, it is shown 2 linear fracture of petrous spotted. Which of the following rules gives the sequence of fracture? Pape's rule. Pape's rule. Which rule helps to determine the sequence of shot fired based on the fracture lines over the skull? Pape's. What are the definite signs of death due to burns? Remember, there are only 3 definite signs of death due to burns. Number 1, soot in the trachea. Soot in the trachea. Soot in the trachea. 100% death due to burns. Number 2, blisters. But blisters may be seen even in postmortem burns as well as putrefactive blisters. Blister containing exudate, that means albumin, along with RBC, WBC, and chloride with red line at the periphery. Now you can see it is antemortem burn. Look here, you can see the vital reaction. Number 3, more than 10% carboxyhemoglobin in the blood, because even normal person may have up to 5% of carboxyhemoglobin. Even smokers may have up to 10% of carboxyhemoglobin. Okay. At the same time, a person may die by only carbon monoxide poisoning. If at all you see increased amount of carboxyhemoglobin along with burns over the body, 100% you can say cause of death is due to burns. Okay. In a completely charred body at autopsy, medical officer can say that the burns are antemortem if he can find soot in respiratory passage. Soot in respiratory passage. Antemortem burn differ from postmortem burn by all except, here the answer is, vesicle with hyperemic base, antemortem. Pus in vesicle, pus means antemortem phenomena. Inflammatory red line, antemortem. Vesicle containing air. Vesicle containing air seen in postmortem blisters, as you see in the second picture. You can see the color changes as well as you can see the blisters. That is postmortem blisters. Not a feature of antemortem burn is air in the blood. Air in the blood. Okay. In an antemortem burn, which is not true, line of redness true, increase in enzymes true, vesicle formation true, but non-albuminous bulla is the best answer here. Vesicle formation, of course, may be putefactive, but here what is the best option? Non-albuminous bulla. Okay. What is the knot in judicial hanging? Simple. Officially used left suboral position. That means below the angle of the jaw. At the angle of the jaw or below the ear. Okay. That is officially used. Sometimes they may ask which is most effective site of the knot. The most effective position is submental because sudden hyperextension, immediate death is 100% guaranteed. But normally they don't use this because many times the knot will not stay here. It may slip. It may slip. That's why they don't use submental position. Just remember, commonly used is left angle of the mandible, but most effective if at all they ask is submental. The knot in judicial hanging is placed at angle of the mandible. Knot in judicial hanging is placed at the side of the neck. Side of the neck means angle of the jaw. What is the most effective method? Position is below the chin. Below the chin. What do you mean by Hammer's fracture? Strictly speaking, Hammer's fracture is fracture of second cervical vertebra. But many books say fracture of C2, C3. Even in MCQs also they say C2, C3. Because you know judicial hanging, most common fracture takes place in C2, C3. That is known as Hammer's fracture. Whereas fracture of C1 is known as Jefferson's fracture and fracture of C6, C7 is known as Undertaker's fracture. Fracture of C6, C7 is known as Undertaker's fracture. Okay. Remember these three different terminologies. Hammer fracture, Jefferson fracture, Undertaker's fracture. Hammer's fracture is usually seen at C2, C3. Death of judicial hanging is because of fracture dislocation of upper cervical vertebrae. Fracture dislocation of upper cervical vertebrae. Judicial hanging is the method of execution of a condemned criminal in our country. The cause of death in such would be, it was asked in FMGE June 21. The answer is fracture dislocation of cervical vertebrae. Fracture at C6, C7 vertebrae is called Undertaker's fracture. Most common method of suicide in India, hanging as per National Crime Record Bureau report. Not only 2014, Your recent report also, they say most common method is hanging. Now coming to the fracture of hyoid bone in asphyxial death. This is very, very important aspect. Hyoid bone is a U-shaped bone situated in the neck above the thyroid cartilage connected with thyrohyoid membrane. There are two types of fracture of the hyoid bone. Number one, antero-posterior compression fracture or outward compression fracture or abduction fracture. Okay. Number two, inward compression fracture or adduction fracture. I explain you in a very basic method. See, this is the anatomy of hyoid bone, U-shaped bone. Hardly there is any gap between the cervical vertebrae and the hyoid bone, maybe less than 1 centimeter. You can see this. Okay. So what happens in case of hanging? In case of hanging, in about 80% of the cases, the ligature is situated above the level of thyroid cartilage over the hyoid bone. When the person hangs himself, the ligature pushes the hyoid bone backwards and slightly upwards. The greater cornu hit against the cervical vertebrae. Now, anteriorly by the ligature, posteriorly by the cervical vertebrae. Because of the compression, hyoid bone get fractured and fractured ends are displaced outwards. Fractured ends are displaced outwards, known as outward compression fracture, which is seen in case of hanging in about 15 to 20% of cases. So, antero-posterior fracture or outward compression fracture or abduction fracture. What do you mean by inward compression fracture? Inward compression fracture is usually seen in throttling. Throttling means what? The person just comes and presses over the neck. If this is the U-shaped bone, exactly the person presses over the U-shaped bone. Now what happens? The greater corner of hyoid bone is compressed inwards and get fractured, and fractured ends are displaced inwards. That's what is known as inward compression fracture. Inward compression fracture, which is seen in about 30 to 50% of cases in throttling. So now we came to know most commonly it is seen in throttling. Okay. Now I show you some question. So most commonly it is seen in throttling. In antemortem fracture of hyoid bone, there is ecchymosis under the periosteum, as you see here. At the same time, if you see the edge of the fracture, you can see hemorrhagic spots. The fracture, once you see, you can see hemorrhagic spots. Okay. In some asphyxial death, hyoid bone usually fractures at the junction of the inner two-third and outer one-third of greater corn. Inner two-third and outer one-third of greater corn. Okay. Remember that. As you see, visualize this picture. And hyoid bone usually fractures after the age of 40 years due to calcification. Due to calcification. Okay. And remember here, hyoid bone fracture is rare in. What is the answer? Again, common sense question. Hanging 15 to 20, throttling 30 to 50, mugging, don't know. Ligature strangulation. You know why? In case of ligature strangulation, ligature is always situated below the level of thyroid cartilage. You see how much gap is there. So, it is rarely seen in ligature strangulation. Antero-posterior compression fracture is seen in hanging. Inward compression fracture is seen in manual strangulation. manual strangulation. Fracture of the hyoid bone is common in throttling. Fracture of the hyoid bone results from all except choking. Choking, blockage of the internal air passage. The incidence of hyoid bone fracture of hanging is 15 to 20%. Cafe coronary, very very important question. Of course, I am almost nearing the time. It is 6:55 now. You want me to extend or shall I stop? See, cafe coronary means sudden and unexpected death of a healthy person during a meal. Sudden and unexpected death of a healthy person during a meal. Remember, this is very very important. There is no signs of respiratory distress or any other classical signs of asphyxia. That means death due to cafe coronary is not an asphyxial death. Asphyxial death. It is normally seen in intoxicated people, maybe intoxication by alcohol or any other sedating or hypnotic agents. Normally, when you are normal, if something goes into larynx, immediately you cough it out because of the gag reflex. But if the person is intoxicated, the gag reflex is inhibited. The bolus of food stimulates the laryngeal nerve endings which is supplied by the vagus. Vagus is cardio inhibitory and it gives rise to death due to cardiac arrest. Death due to cardiac arrest. Okay. So remember, what is the cause of death? Cause of death is vagal stimulation or cause of death is cardiac arrest. Absolutely, there are no signs of asphyxia in choking. There are no, absolutely there are no signs of asphyxia in case of cafe coronary, but whereas in choking, there are signs of asphyxia. Because choking is asphyxial death. Cafe coronary, it mimics MI, that's what is known as cafe coronary. Cafe coronary is associated with intoxication. Intoxication. In case of cafe coronary, the cause of death is, answer is vagal stimulation. Okay. In case of cafe coronary, cause of death is, here the answer should be cardiac arrest because there is no asphyxial changes and choking is a case of asphyxia. Okay. Somebody asked me to repeat. What do you want me to repeat, Dr. Daksh? Okay. A person is brought dead to the mortuary. History revealed that he collapsed while having dinner. See, this is a very, very intelligent question prepared by me, myself. On exam, there was cyanosis, critical hemorrhages, and a bolus of food in the larynx. Alcohol level was 120 milligram per set. What is the cause of death? Now, tell me, what is your answer? I give you some time. What is the answer for this? See, now, again you do mistake. You say, cafe coronary. But look here, in the question I highlighted, there is cyanosis and critical hemorrhages. I already told you. I already told you. There is no signs of asphyxia in cafe coronary. But there are signs of asphyxia, that is cyanosis and critical hemorrhages. So how can it be cafe coronary? So here the answer is choking. Here the answer is choking. Remember that. Okay. Now, very important topic, drowning. Drowning. Okay. Drowning, as you know, aspiration of fluid into the lungs by complete or partial submersion. Aspiration of fluid into the lungs by complete or partial submersion. Where maybe in water or any other fluid. Okay. See, otherwise, what I do is I will complete the topic on this drowning. I will take one more session After completion of all the session every day, that is 5 to 7, after that, after last day of the DocTutorials session, I will go for one more session. That is better, I feel. Otherwise, for you also, it will be boring going beyond 2 hours. Is it okay for you? Okay. And some people are asking about regarding some this one toxicology. And one more thing I tell you, I don't know whether you are there or not in my Telegram group. You just type at the rate of forensic JP in Telegram. Then you can join my Telegram group. Every day I am conducting the MCQ quiz since so many days. If you scroll back, you can see the previous questions also. And press over the files. There are multiple PDFs are there. Many important one-liners, so many and pictures. For example, other day in said Arjumon Mexicana question was asked. At the same time, fingerprint develops in 12 to 16 weeks. Just 3 days back, I had conducted the quiz. Same question had come. Okay. Okay. Now, classification. Number 1, wet drowning. Wet drowning. What is wet drowning? Person falls into water. Water enters into lungs. Water acts as foreign body. Foreign body stimulates the secretion of mucus. Secretion of mucus. Because of the violent respiratory act of the person, this mucus gets churned, mixed properly with the water, liberates copious amount of white fine leathery froth which gets collected in the lungs, give rise to pulmonary edema. The condition of the lung is known as emphysema aquosa. Emphysema aquosa. Water is inhaled. It is just like you take one bucket of water, add surf into that. Surf is like mucus. You put your hands and stir properly. The more and more you stir, more and more froth you get. Same mechanism here. Mucus act like surf. Violent respiratory efforts mixes the froth with the water, give rise to a condition called emphysema aquosa. Look at this lung. So voluminous lung. So voluminous lung. Okay. Okay. Now, that froth will come out through the mouth and nostril. Very rarely it may be blood stained. If there is rupture of the alveoli, it may be blood stained also. Otherwise, it will be white, fine froth. Even if you open the larynx as well as trachea, you can see copious amount of white, fine, leathery froth. Now, what is the cause of death in wet drowning? So, other day somebody asked, then I said I will discuss today. Cause of death in wet drowning. See, in both seawater drowning as well as freshwater drowning, because of the entry of the water, it may give rise to disruption of the pulmonary surfactant and it may cause death of a person. So, cause of death in wet drowning is disruption of pulmonary surfactant. Number 1. Okay. Now, what is the difference between freshwater drowning and saltwater drowning? In both the cases, what takes place is osmosis. Osmosis means water moves from lower concentration to higher concentration of salinity. In freshwater drowning, the salinity of the blood is more than water. So, water from lungs enters into blood. Water enters into lungs. From lungs, it enters into blood because salinity of the blood is more than water. That gives rise to hemodilution. Hemodilution causes swelling of the RBC. RBC get ruptured, known as hemolysis. And RBC contain potassium that give rise to hyperkalemia. And person dies of ventricular fibrillation. Person dies of ventricular fibrillation. See this carefully. It is very, very important. Okay. Okay. Saltwater drowning, exactly opposite takes place. Exactly opposite takes place. water from blood enters into lungs. That gives rise to hemoconcentration. Once there is hemoconcentration, there will be hypernatremia, which give rise to bradycardia and cardiac arrest, and person dies in about 8 to 12 minutes. 8 to 12 minutes. Okay. 8 to 12 minutes. Now, somebody asks, what is the cause of death in wet drowning? Disruption of pulmonary surfactant, number 1. Number 2, hyperkalemia. Number 3, ventricular fibrillation. Number 4, hypernatremia. Number 5, cardiac arrest. Anything. Okay, only thing you should know the mechanism. Hyperkalemia normally associated with rupture of the RBC, freshwater drowning. Not associated with saltwater drowning. Hypernatremia, yes. Hemoconcentration, yes. Bradycardia, yes. Hemolysis is in freshwater drowning. Freshwater drowning. Okay. Number 2, submersion of an unconscious person. Imagine one unconscious person falls into water, water enters into lungs, but there is no proper respiratory movement because he is unconscious. Mucus gets secreted, it mixed up with water, but proper churning does not take place. It is just like you put one broomstick and turn. You don't get the proper froth. So there is minimum froth with pulmonary edema, known as edema aquosum. Known as edema aquosum. Okay. You understood? So, you know the difference between emphysema aquosum and edema aquosum now. Dry drowning. As soon as person falls into water, water trickles the larynx, person dies of laryngospasm. Absolutely no fraud. Absolutely no fraud. Dry drowning. Because there is no water, it is known as dry drowning. Dry drowning, a case of drowning in which fluid cannot enter the lungs due to laryngospasm. Okay. Dry drowning is defined as drowning where death is due to laryngospasm. Okay. Number 4, immersion syndrome. As soon as person falls into water, maybe because of very cold water or water entering into the eardrums or water striking the epigastrium, immediately dies of vagal inhibition. Vagal inhibition. Strictly speaking, this is also dry drowning only because there is no water in the lungs. But all the books mention this as hydrocution or immersion syndrome. Laryngospasm death is as dry drowning. But remember, no fraud in dry drowning as well as immersion syndrome. Absolutely no fraud. Okay, it is most common in children and intoxicated people. Intoxicated people. Hydrocution means immersion syndrome. Immersion syndrome. Okay. Number 5, secondary drowning or post-immersion syndrome. So here, submersion victim is resuscitated. A person who fallen into water, he has been removed from the water, but he dies after 24 hours due to complications. Most common complication is post-hypoxic encephalopathy. By this time, what happens? Whatever the froth is there, get absorbed into the system. Again, you don't get any froth. So, maximum froth in emphysema aquosum, minimum froth in edema aquosum, no froth in dry drowning, immersion syndrome, and secondary drowning. Keep that in your mind. What is near drowning? Near drowning is not a classification. Some books say near drowning. No, you see, I just fall into water, somebody just remove me. Yesterday I was about to die, man. I fell into water. That is near drowning. I survived the drowning episode. It does not die. Okay. What is the most common cause of death in secondary drowning? Post-hypoxic encephalopathy. Post-hypoxic encephalopathy. Type of drowning where death occurs from complication of drowning after being resuscitated is known as secondary drowning. Secondary drowning. Cause of death in dry drowning is Disruption of pulmonary surfactant, wrong, because it dry drowning. Ventricular fibrillation, no, because it is dry drowning. Fluid and electrolyte changes, no. Answer is laryngeal spasm and consequent hypoxia. I hope you are getting proper concept in this. Cause of death in wet drowning is disruption of pulmonary surfactant, ventricular fibrillation, fluid and electrical changes, any of the above. Any of the above. Froth is produced in dry drowning, no. Immersion syndrome, no. Submersion, yes. Second drowning, no. Answer is submersion of an unconscious. See how many questions are there in this drowning. What a hydrostatic lung. If you keep a dead body in a water more than 2 meters depth for more than a period of 20 hours, because of hydrostatic force, water enters into lungs become edematous, but absolutely no froth. Pulmonary edema, but no froth. It is known as postmortem immersion. That is hydrostatic lung. So now you have three types of lungs. Number one, emphysema. Number two, edema. Number three, hydrostatic lung. Hydrostatic lung. Hydrostatic lung is seen in case of postmortem immersion. Emphysema is seen in wet drowning. Wet drowning. Edema occurs in none. Edema is seen in submersion of an unconscious person. Okay. Edema occurs in, already I told you the answer, submersion of an unconscious person. A person is alive and conscious. Emphysema. A person is alive but unconscious. Okay, emphysema, you see edema with copious froth. A person is alive but unconscious and falls into water. Edema aquosum. There is edema but minimal froth. Now I am telling you exactly what is the difference between these three. A person is dead. Hydrostatic lung. There is edema but no froth. There is edema but no froth. Okay. So that is regarding three different types of lung. The different signs of antemortem drowning. Lastly, different signs of antemortem drowning. Number one, cadaveric spasm with weeds and grass in the hand. Cadaveric spasm with weeds and grass in the hand. A person falls. He wants to survive. He tried to catch whatever come across his way. Maybe some seaweeds, grass, whatever it is. Definitely can say he was alive at the time of death. In a sense, it is not putting a dead body into water. Number two, emphysema, already I explained. Number three, copious amount of white fine leathery froth, that is due to emphysema, interconnected. Number four, Paltov's hemorrhages. Here there are 2-3 questions. Paltov's hemorrhages are due to the rupture of the alveoli, seen in subpleural space in about 50% of cases. Most common location is lower lobes. Okay. Very small, up to 3 to 5 centimeter in diameter. Remember, so-called pedicle hemorrhages are not seen in case of drowning. In drowning, because of rupture of alveoli, you can see hemorrhage known as Paltov's hemorrhages. Look here. Okay. What man? Who is this? Surya Panikkar. You are asking Telegram group name. You see my slide. My each and every slide in the lower left corner I have given. Telegram group at the rate of forensic JP. And you are asking me what is the Telegram group name? That in red background it is given in white letter. Okay. Part of hemorrhages are seen in death due to drowning. Death due to drowning. And finally, diatoms. Diatoms I put a question mark because some say that even in a normal person there will be diatom. Whatever water you drink, each and every water contains diatom. It get absorbed into the intestine and it is seen in any person, whatever the cause of death. Okay. But I will tell you how exactly to choose your answer. Okay. But diatoms is very important for your MCQ. The outer silicaceous coat of diatom is known as perjury. This is important MCQ. The outer silicaceous coat is known as perjury. Okay. Perjury is resistant to heat, acid, and putrefaction. Okay. It is examined by acid digestion techniques. See, all these are one MCQ. Okay. Best organ for the study of diatom is femur. But femur means you have to cut open the thigh, open the femur. Your cosmetic purpose is not good. You have to vigilate the body. So, most commonly used is sternum. Sternum. Okay. Most preferred soft organ is kidney. All these are important MCQs. Okay. Now, I will tell you how exactly you should answer. Characteristic feature of drowning is best answer you have to select. The best answer is cadaveric spasm. Wash your human hands even if you wash your clothes for a long time, you get that. Water in the stomach, a person may drink water and later after some time he may die of myocardial infarction and he may fall into water. Water in the stomach does not mean that he has to die by drowning. Diatoms, I said question mark. So best answer here, even though diatom is there, cadaveric spasm. Correct feature of drowning is diatom, emphysema aquosum, temporal bone hemorrhages, water in stomach. Answer is emphysema aquosum. Because temporal bone hemorrhages may be seen in hanging, strangulation, carbon monoxide poisoning, head injury. Okay, emphysema aquosum. Here, correct feature of drowning is best answer is copious fine froth in the mouth. Remember, copious fine, the copious word is very, very important. Okay. One of the following is definite sign of death due to drowning. Wash your woman's hands and feet, diatoms in bone marrow, sand and mud in the mouth, fine leathery froth in the mouth and nostril. You got it? Now, what is the best answer? Diatom, edema of the lung, Poltoff's hemorrhages. Because edema, they are not mentioned. Edema aquosum or emphysema aquosum. Edema means pulmonary edema. Pulmonary edema may be seen in any other natural cause of death also. Even in barbiturate poisoning, alcohol poisoning, snake bite poisoning, there may be pulmonary edema. Okay. Third feature of drowning is diatoms, froth in the mouth, Poltoff's hemorrhages, water in stomach. Answer is Poltoff's. Best indicator of antemortem drowning is, what is the answer? Wash human hands, I already said. Water in nose, different. Copious froth in mouth and nostrils. That is the answer. Cut the feature of drowning is here. Just because froth is there, don't say that is the answer. Copious word is very important. So, here the best answer is diatoms. Any causes of pulmonary edema can give rise to froth. If copious froth is there, then only should be the answer. Not a definite sign of drowning. Definite sign, 100%. Cadaveric spasm, yes. Emphysema aquosum, yes. Part of. Yes. Water is tough. Answer. Okay. The conclusive evidence of death due to drowning is. Conclusive evidence of death due to drowning. Conclusive. What in the stomach? No. Temporal bone hammer? No. Datum. I already said I put a question mark. It is not conclusive. So answer is none of the above. None of the above. Okay. So that's all. Stop for today. So after the end of the session, because now actually my time. So after the end of all the sessions on one, otherwise even it will be boring also for you if I talk now. Already 2 hours 20 minutes got over, and if I even further continue, then I don't know. I am not available to you. He may throw stones also on me. So I will take one more session. That time I will take remaining aspects. Okay. And meantime, as I told you, I tell you again, Telegram group is already given here. Lower down, it is given already. It is at the rate of forensic JP. You can go through the files and the PDF. There I have uploaded so many photos, toxicology, everything. Toxicology handle is given there. Okay, you can go through that. Nothing much to worry. Wish you all the best. Do well in your examination. Do well in your examination. Okay. Bye-bye. All the best. Okay. Okay, next time. Next time. Okay, don't take any tension or stress or anything. Okay, and don't start with any fresh topic. Whatever you have studied, same thing you revise. Same thing you revise. Okay. See you again. Okay. If you have any doubts or if you want any discussion, even in my group, I have given my telephone number also. You can call me at any time. If you want for a long discussion, I will explain. And you can write any number of doubts you can ask in the group. On the spot, I will give you answer. Okay. Wish all the best. Bye-bye. Bye.